Welcome once again. Today we are looking at counseling therapy, and the specific topic that we want to look at is client testing and assessment. How do you test the client? How do you know how do you diagnose the challenge or the problem that the client is going through as a counselor? This is your host, Dr. Tulipo Mwenifumbo. Remember these programs, we offer different and varieties of programs. We have got short-time programs and we have got full-time programs. We have got certificates, bachelors, and also we have got diplomas. So if you want to do the short programs, which are more like workshops, you can do them just for 2 weeks, and we offer the diplomas for 1 year and also the bachelors in 2 years. Those bachelors are 4 years bachelors, which is equivalent. They are 4 years bachelors, and also the diplomas, 3 years diplomas, which we compact it in 1 year. So we are looking at Unit 5, which is assessment and testing in counseling. We are going to look at overview of assessment and testing, then we are going to look at types of assessment and tests, and then we are going to look at ethical considerations in assessment and testing. So, number one, overview of assessment and testing. Assessment and testing are essential components of the counseling process. They help counselors, number one, to understand client strengths, weaknesses, and also concerns. They also help to identify potential issues or problems. They help us to develop effective treatment plans and also to evaluate progress and outcomes on our clients. So now when we talk about definition of assessment and testing, we are talking about assessment and testing refer to the process of evaluating an individual's cognitive, emotional, behavioral, and psychological function. This can be done through various methods. So we are saying that when we talk about assessment and testing, we are trying to we are trying to diagnose the challenge and the problem that our client is facing through what is called counseling assessment and testing. And in doing this, we use what is called cognitive, emotional, behavioral, and psychological functionings. So there are different types of methods that are used when you are doing what is called assessment and testing. Number one, there is what is called standardized tests. These are tests that are administered and scored in a consistent manner. Then there is also an assessment to assess your clients by observing them. This involves observing an individual's behavior or performance in a specific context. For example, you may see your client is just is unrest, whereby he is just standing. You observe the body language. You observe also how the client is behaving. That will be able to give you what is involved in testing and observation, testing, which is assessing the client's challenge. Then also interviewing, you by interviewing or by probing the client, you'll be able to understand the extent of the challenge and the problem that the client is going through. This involves asking an individual questions to gather information about their thoughts, feelings, and behaviors. So remember what we did in counseling skills. So that is also trying to diagnose or trying to test the client's challenge. Then self-report measures. This involves asking an individual to complete a questionnaire or rating scale to provide information about themselves. What is the purpose of assessment and testing? The purpose of assessment and testing can vary depending on the context, but some common goals include identifying strengths and weaknesses. So we are trying to identify the strength and the weakness of our clients. How is this challenge impacting your client? So assessment and testing can help identify areas where an individual excels or struggles. So you'll be able to know where you can be able to help your client. Then there is also diagnosing mental health conditions. This helps us to assess or to diagnose mental health conditions such as anxiety and depression. So by through testing and assessment, you'll be able to see the fears that your client is having by looking at the observation, the body language, how the voice is coming, the words that are used, like I'm so depressed, I'm discouraged. So there are certain words which look synonymous, but when it comes to counseling, they'll be able to have a distinct difference. Then developing treatment plans, it will also help you as a counselor to plan for the therapy that you're going to take. Assessment and testing can help inform the development of treatment plans tailored to an individual's specific needs. Remember, counseling goes to a specific individuals. There is no formula that you can use for every person because each individual has got different problems. There is what is called threshold in every person. So the threshold, it is the ability to endure the challenge. So there are some people that have got high threshold, others who have low threshold. When we talk about high threshold, we are talking about those that can be able to endure something. You can sometimes think, is this the problem that you are facing? Especially in traditional counseling, where you criticize the client. Why are you having problem? Is this the problem? But in professional counseling, you have to know and to realize that every problem, every person is unique. What somebody can endure, another person can even commit suicide over it. You see, so in assessment, when you are developing my plans, you develop the plans according to individuals. Then it will also help you to evaluate progress. You saw your client was not lasting, was very uneasy and all that. Then you see this client begins to recover. Then it will help you to uh, assess. So there are different types of assessment and testing. There are many different types of assessment and testing. There is you test intelligence quotient. Uh, these tests measures cognitive abilities such as reasoning and problem solving. There is also achievement tests. These tests measures an individual's knowledge or skills in a specific area such as math and reading. So that is where now you give maybe a test to a client whereby they have to read something or they have to solve something. Then there is also personality test. These tests measures an individual personality traits such as extroversion or neuroticism. So they are in trying to build the personality test. That's where now you'll be able to know, is this person a extrovert or is this person introvert? So in doing that, you'll be able to understand. There are some people that may pretend. So through the test, you may be able to know even if he looks quiet, this person is talkative. Then also you are able to test what is called neuropsychological test. This test measures cognitive functions such as attention or memory. So you ask a person, then say, so in that one, you'll be able to know the challenges that the challenge is what is called neuropsychology. Importance of assessment and testing. Assessment and testing are important because they can inform treatment decision. Assessment and testing can help inform the development of treatment plans tailored, then evaluate progress, as we said, then identify areas for improvement. So you'll be able to identify the areas where your client needs to improve. Then also provide a baseline for future evaluations. So you are able to also to do the test on the achievements, neuropsychology, personality tests, behavioral assessments, emotional intelligence, and vocational assessment. Because counseling has got different areas. Someone may have a challenge on vocation, another one may have a challenge psychological, and there is a challenge cognitively. Then there is also what is called forensic assessment. Forensic assessment evaluates competence, risk, and capability in legal contexts. Example, competence to stand trial, assessment instrument, violence risk appraisal. So these are some of the things that has to be looked at. There is also what is called ethical consideration in assessment. By considering these ethical principles, assessors and testers can ensure that assessment and testing are conducted in a responsible and beneficial way. Number one, if you have to remember to inform your client. Clients have the right to know the purpose, risks, and benefits of assessment. So when you're doing psychological assessment or counseling assessment, you need to inform the client and why you are doing that. Then also you need to assure the client on confidentiality. Confidentiality, that's where you tell the client that you are confident, you are going to keep whatever assessment in the confidential. Then cultural sensitivity, you need also to assess culturally, because some of the things in other cultures, it may be a taboo. You just asking somebody it's in another culture, it is okay, but with other cultures it may not be okay. So assessment and test must you must be culturally sensitive. Result must be interpreted in a different context. Then there is competence. Assessors and testers must be competent in administering and interpreting assessments. Test security. Assessment must be secured, and it has to be secured to prevent tampering or unauthorized access. Fairness and bias. You need to assess with fair. There must be respect in assessment. Then avoid harm, and also transparency and accountability. You need to be transparent and you need to be accountable. Continuous professional development. So those are the things that are required in assessment. Remember that we are offering varieties of courses. We have got business administration, data analysis. These are short courses. Monitoring and evaluation, financial management, record management, HIV management, and also psychosocial counseling. So you can register in any of these courses. Thank you so much, and God bless you. Meet you in the next class. This is your host, Dr. Tulipo